Seen a rise in COVID cases in Lexington. The health department issued a statement last night confirming an increase in the cases.
WKYT's Lucy Bryson spoke with the health department today about how to adapt to this increase. That's our top story at noon.
The health department says that over 260 cases of COVID-19 were confirmed just last week. When comparing that to early July's count of only 35 cases, the numbers have increased just about 600%. But still, health officials are urging Lexington to stay calm.
This is not a reason to panic, but a reason to be cautious.
Spokesperson of the Lexington-Fayette County Health Department, Kevin Hall, shared that although numbers are up, they aren't alarmed. When comparing the numbers to last year at this time, 2023 has significantly less cases.
We had almost 900 new cases a week, so we're nowhere near that level.
The Lexington mayor's office told us Monday afternoon 9 cases of COVID-19 had been confirmed at Lexington's E911 emergency dispatch center, causing some employees to have to leave work.
When people are sick, they can't come to work. There are other people who have to fill in those gaps to keep working. We want to do everything we can to protect these essential workers. We want to keep the strain off of their emergency services.
The backup E911 center has been activated and operations are continuing as normal, but for others in the community worried about the spread, he gives a word of advice.
We don't want to forget that COVID is still out there and that it is spreading. And so people need to make sure they're staying home when they're sick, they're washing their hands frequently.
Hall shared that a new booster vaccination is expected to be announced at the federal level in September. In Lexington, Lucy Bryson, WKYT.
And according to the health department's Facebook update, hospitalizations are still low right now, with less than 10 people in hospitals for COVID-19.